Welcome to the Spiritual Connection Podcast. I am your host, Jill. In this podcast, we're going to be talking about your energy, their energy, manifesting, mindset, creating high vibrational healing for you, body work, the importance of massage and self-care, and much, much more. Let's get rolling. Hello, everyone. Welcome back to Om Shanti Healing's podcast, The Spiritual Connection. I am so grateful and honored to have Dr. Danny Dowling locally here with me. His business is called the Nomadic Naturopath. Thank you so much for being here, Danny. How's your day going?
Going great. Thanks for having me.
Thank you so much for being on. I really appreciate you spending time with me. Today, we're going to discuss anxiety and all components of what Danny knows within his scope of practice on anxiety and how to help people with it. But before we get going, Danny, I would love to hear your story on how you became a naturopathic doctor, what led you to it, and just share with the audience what naturopathic means for those that are just misinformed or haven't heard of it before.
Yeah, so naturopathic doctor, there's a lot of confusion around it because there are people that go to 2-year online programs and market themselves as natural medicine doctors, and they haven't had the clinical training, they haven't taken board exams, they haven't actually gone to a medical school, and they market themselves as natural medicine doctors. So you can run into issues there in terms of, they don't know how to manage medications. So what I've been trained in is generally I've been trained as a general practitioner, a primary care physician. In addition to that, we learn a lot about herbal medicine, botanical medicine, nutrition, counseling. We learn chiropractic adjustments. We do a lot of homeopathy and different things. So basically, just adding a lot of integrative modalities on top of the diagnostics and doing the conventional pharmacological care. And one thing I will add is that I can't do a lot of pharmacological prescribing in Colorado State. I was educated and trained in Washington State. So there's a lot of legal, bureaucratic things that are going on with licensed naturopathic doctors. But I get to navigate pretty much and do everything that I can outside of that. So everything that I that I do with patients centers around diet, nutrition, lifestyle therapies, botanical medicine. And really people come to me just because they don't often know what's going on with them. They go to their regular doctor, they do basic blood work, and they still don't know what's going on. Their blood work's normal and they still have all these symptoms. So typically what happens and why I love talking about anxiety like we are today is because a lot of people are just handed a prescription for an SSRI or a benzodiazepine, because you must be depressed or anxious if we don't know what's going on and you still have all these symptoms. So
Right. And
it's
not
not
knowing the root of the problem, just putting a
exactly
band-aid on top of it.
exactly. So everything that I do is really focused around treating or identifying the underlying cause and then treating that with the least force intervention possible. Sometimes you do have to do higher force intervention to help kind of mitigate symptoms, help people function through their daily life. The other thing is just everybody's at a different place financially in terms of their knowledge around and capacity to, buy organic food or good quality food. Food scarcity is an issue in the US. So those are things that we're going to talk about and just kind of clarify. But yeah. And then in terms of my story. So the reason why I got into naturopathic medicine, a big part of it was because when I was 11, my dad passed away suddenly from cardiovascular disease. He was a dentist. He was versed in the biological dentistry world, and he was prescribing supplements and medications and things through his practice. And he had actually taken a program in naturopathy, which I didn't realize until later. Um, but I was inspired to go into medicine from him. You know, he taught me his work ethic, and losing someone and going through that, the abrupt introduction to death and what that means really encourages you to embrace life a lot more. And I really wanted to help other people prevent going through that kind of pain with their parents or their loved ones. So that was a big instigation for me going into healthcare. And then I had my own sports injuries, so I wanted to be an orthopedic surgeon at one point. I was going through I have my undergraduate degree in human biology and infectious disease at the University of Kansas. So I went through the whole pre-med kind of prep before regular medical school, and as I was going through that, I just got really uninspired. I realized that everybody around me didn't really know how to eat well or nourish their body or take care of their body. Um, and it wasn't really a concern at all either. Obviously, you're in your 20s, you're out drinking, pushing all the buttons, pushing all all the boundaries with your physical health because you can. And I was, meanwhile, seeing family members pass away, other family members, and just seeing people, run into using antibiotics for simple ear infections, being put on medications for blood sugar regulation, things like that. Um, and I was always kind of the weird one in the house eating healthy food and spending more money on groceries than anybody. So I don't know. It was just came natural to me. But
Yeah.
nutrition was kind of what has always been the backbone of what really inspired me and still does with my patients. I love that there's not like that's that's where I fill in the gaps most of the time is there's so much nuance to nutrition, and be that if it's something that causes your symptoms or your condition, or if it's just using nutrition to either treat things or address removing those things that are contributing to the issue, and enhancing some people's health. So some people just come to me because they want to be proactive and preventative. And a lot of people think I'm just, managing supplements and, giving basic nutrient guidance, but it's very nuanced and very in depth. And
Yeah, and
most people,
everybody's got their own unique story, right? And
oh,
their own history. It's important to really know
yeah,
what their story is and how they've treated their body up until the point that they met you.
yeah,
Yeah.
yeah,
What are the patterns? What are the bad habits?
yeah. And a lot of times people don't really realize what symptoms they're dealing with on a daily basis until they write it out or they talk about it with me. So that's the other big thing is I spend 60 to 90 minutes with new patients, and that in that time in that investigative process, like that is what makes a big difference. Because then I can, people come to me, they want to run all these labs because they want to actually figure out what's going on. But that's often not necessary. Like you can find out so much information. I'm ruling things in and out left and right with every little detail that they tell me. So I get so pumped whenever I talk to people and I'm just like putting it together in my head, and sometimes I have to hold back because I'm like I'll stop and explain like, oh, this is what I'm thinking clinically, and I think that really, people aren't getting that from their doctor. There's not a lot of just common sense putting together what is factual and going back to the basic sciences and physiology and bringing that to the conversation of because what I'm trying to do is encourage healthy physiology. But there's been a kind of an abandonment of caring about that because there's not a lot of health promotion that's going on. It's a lot of tinkering and manipulating receptors and suppressing things and killing things. And if you have, 6 to 15 minutes with your primary care doctor, that's about all they can do.
Right. There's so much value in the time that you spend to really get to know someone
Right.
and take note of their history. That's a beautiful thing. It's something that should be in mainstream.
Yeah,
but it is not. The problem is the pharmaceuticals industry is so powerful, and doctors get perks from prescribing medications, and
yeah,
yeah, it's true, and they win trips and vacations and stuff like that
yeah,
for prescribing certain kinds of drugs. So they try to do that more and more, which is not benefiting the patient necessarily in the right ways,
totally.
and then there's the side effects, of course, that comes with everything.
Yeah, and doctors are in a pickle. It's they didn't get into healthcare because they wanted to, manage medications and keep people sick. But that's often what happens when you're in this insurance model and hospital model, and you have to see a certain amount of patients a day. It turns into a business instead of what it should be is, focused around healing, and it's not. So,
Yeah.
and then
Yeah.
and mental health is just it's subjective in a lot of ways. Y- there's not a lot of there hasn't been a lot of upgrades in our pharmacological care for it. And the pharmacological care we do have has a lot of side effects and dependence and other things attached to it, which is why I get so worked up because it it's unfortunate when patients come to me and they're already on a lot of these psychiatric medications, and it's hard to parse out what's a side effect of the medication and what's not. And then also you run into, their affect is flat. They have, different issues with libido and sexual arousal and inability to have sometimes an inability to have an orgasm, things like that nobody wants. And then, I'm going to get into this more, but so
Yeah.
SSRIs and benzodiazepines are kind of the main two medications that I'm going to highlight today. I mean,
Okay.
there are other ones, but those are the ones that I see the most common.
Mhm.
And yeah, they're just handed out like candy.
Yeah, it's really quite sad. And I myself have been on SSRIs, and Lexapro, gave me anti-orgasmosis, as they call it. It's a syndrome, a side effect of the pill. And yeah, as soon as I discovered that, I went off it right away.
Yeah,
I wanted to ask you, um, in regards to anxiety, this is kind of the topic of the day for us.
right.
What do you believe are the current rates of anxiety right now in the US? And what would be the subset of the population dealing with it the most that you think?
Yeah. So from what I've recently looked up based on the CDC records and reports from 2022 to 2024, 1 in 5 adults has reported anxiety in the last 2 weeks. So, and that's a large percentage. That's 20% of the population. Another number I was looking at was 40 million adults in the US. But that's adults, and the population that's affected the most is this age range, young adults, which is 18 to 29-year-olds, and they're at about 26%, 27% reporting anxiety symptoms in the past 2 weeks. So that's based on GAD-7 reporting. It's not accounting for what's outside of that either. So
Right.
um, that could be, and this is mostly generalized anxiety. This is mild, moderate, severe, you name it.
Yeah. Just
This,
kind of that vibration all day long, just in the background, ruining your day every day. And yeah, I feel like the generation to come, that's kind of uh, the younger kids, I feel for them, on as far as environment, the
yeah,
planet, the politics. We don't need to go into politics, but you know what I'm saying. It's like I feel like there's a struggle in what is there to look forward to,
hmm
right? And that creates anxiety because they have a long life ahead of them, and affordability is a major problem.
yeah. And
You know,
you have kids too, right? So you're seeing it firsthand.
yeah, my son turns 20 on Friday, tomorrow,
Yeah,
and he had a moment with me that he's like, Mom, I feel like I'm never going to be able to afford my own house and I'm never going to be able to travel and do the things that I want to do because everything's so expensive and I don't make enough money and I'm never going to make enough money. And he just went off and
Yeah.
like spun out. And, we talked him down and he's doing much better, but I don't think he's alone.
Yeah.
I know that he's not alone. And my daughter's going to be 18 in April and she's feeling it too. She's like, what is there, what's the point of any of it?
Yeah.
Because we're never going to get what we want. And, it's also the child brain. They can get the things that they want. They just got to work really hard to get it, just like everybody else and make a plan, have a path, go after it real hard and fast and, grunt it out. And you'll get the things that you want down the road.
Yeah.
But overall, I think there's an undercurrent
Yeah.
globally,
Yeah.
within that age group, you know, everybody's feeling it.
Yeah.
I
So,
think that internet and all the intel that's constantly being downloaded into our heads is definitely contributing to that.
yeah, definitely. And I was going to say the subset of population that's affected the most is generally young women in that age range, 18 to
Mhm.
29.
Yeah.
Um,
Interesting.
and so you throw in social media and globalization and yeah, like you said, political and ideological
Yeah.
things that are being spun and funneled our direction. That in itself is huge. And then you throw in, going to college and expenses, debt, just what I see with my patients too in that age range. It's funny, there's a lot of similar patterns that I see, like with perfectionism and just being very hard on themselves. And I don't know if that's a result of the social media comparison thing and
Yeah.
people, seeing other people in their brightest light, the highlights of their life and maybe even some people that they're envious of or whatever, and that creating this, feeling like I'm not good enough.
Right. I think that's a huge component of it.
Totally.
The comparing. And
Yeah.
a lot of that stuff that you see isn't even real, anyways. People are not, everybody's got their baggage, right? And their stuff that they're carrying around. And everyone puts on their masks and shows up in front of others a certain way. But in the background, everybody's got their turmoil. No one has a perfect life where everything is always going right. How boring would that be, anyways, right?
Yeah. Yeah. Yeah, and if they do, it doesn't give them perspective, and it doesn't, it's these stressors and the challenges that I think are necessary for strengthening. I think we're going through a big change globally and psychologically and maybe energetically, all of that. Um, just a transformation that we're needing to adjust and strengthen for. Like
Yeah,
we either have to step up to the challenges or we're going to get consumed by them. And in my mind, in my book, like I'm fairly young too, so I'm just new to like seeing the benefits of all the hard work I've put in. You know, it's and it still every day is like uphill battle, but you know I I have like just the nature of like being able to help people, which I feel like is really, that's another interesting thing is a lot of people are doing jobs that maybe aren't fulfilling and not hitting that like service button. I think we all want to be of service
yeah,
with
very
bring
true.
yeah,
And what does that even look like for the 18-year-old, right?
yeah,
The 20-year-old. There's a sense of urgency in their energy at that age of trying to figure it all out.
yeah,
I just had a conversation with my daughter about college, right before I spoke with you,
mhm,
and there's a lot of stress on planning for the long term and when, she really doesn't have to plan for the long term, you know,
yeah,
she just
yeah,
needs to plan for the next couple years and sit with that for a while,
yeah,
but there's a lot of pressure, I think, with financial obligations to just survive. And people see the people on social media that have all the stuff and the things and the success and the money and the glory and the
Yeah.
entitlement. And they're like, ooh, I want a piece of that. But they have no idea how to get it. What direction do you go to find that, to get what those people have? And there are paths to get things that you want,
Yeah.
but just finding the vehicle or the coaching or the right connection to the right tribe to show
Yeah.
you how to get it is very hard.
Yeah. And then the lack of well, I think the other thing is we went through the pandemic, right? Which is an obvious factor that we have to take into consideration for all of us. But um, that generation in particular and the social skills that are needed that are such a integral piece of being able to plan and know what's realistic. Like I talk to a lot of people, a lot of the people that put a lot of stress on themselves and feel really defeated. They're trying to bite off more than they need to and more than they can chew. And it's kind of a form of self-sabotage in a way. It's the little steps, the day by day, the one conversation. When for you and I with networking and all of that, it's such a like microcosm of the importance of community and relationships and being able to see things grow and develop and like okay, well, now we're here like having this conversation over podcasts. If I had never gone to the Chamber of Commerce, this would have never happened. I would have never been able to like present my business 2 weeks ago at a red carpet. It's like being able to reflect and see how the little steps have gotten us to where we are now. And it is those little things that seem monotonous or going through medical school, studying in school, doing all that stuff. It seems monotonous and you're paying to do all that work, which is another kind of weird, false, like backwards incentive. So it's hard to really understand what all the work is actually leading to
Yeah,
until you're there or until
right.
until until you start gaining some momentum.
Right. It's all foundational at the very beginning,
Yeah,
right? You're just putting your roots in, you're getting momentum, and you are doing the grunt work. And it gets easier over time as you get better at one specific thing and become an expert at that,
yeah.
and then you can maybe, teach others down the road. So I
Mhm.
wanted to talk about some other foundational things in your opinion that we should know about around anxiety. We
Mhm.
talked kind of like about emotional and kind of mental perspectives, right? We've kind of discussed that already. But what about physiological and biological components of anxiety in your opinion?
Yeah. So this is my wheelhouse. This is where I help people, and I think there's always a two-way street where you need to work on the emotional and the mental piece of it. But a big piece of being able to do that comes from the physiological problems that might be coming up or are causing the issue in the first place. So, you have anxiety, depression. First idea is like go see a psychiatrist or a therapist. Um, but a lot of times, you're dealing with either some kind of autonomic nervous system dysregulation, which is kind of the big first piece that I wanted to highlight. I'll talk about that for a second here. So it's a autonomic nervous system is kind of the primitive branch of your nervous system. It's part of your brainstem. There's two outlets that come out at the brainstem and then the pelvic area. So I actually do craniosacral therapy in my practice, and it's aimed at stimulating those two outlets of your rest and digest nervous system. And I like to say rest, digest, and heal because a lot of us are running around in our sympathetic states, fight or flight. buzzing around, and that's not a state to be in when you're trying to eat or rest or heal. You can't heal very well when you're
Exactly.
in that state all the time.
Yeah, it's counterproductive. It's hard to get unstuck from that place though sometimes.
Yeah. I mean, and that you're always stimulating both of those branches. So parasympathetic is your rest and digest, and sympathetic. They're always both on, but it's kind of like a teeter-totter. So you want to balance it out as much as you can,
Yeah.
and whatever that means. It could come from a thought process, like, maybe like for instance, kind of preparing for this for us talking today. It's like I went on a walk, it's like I'm in my head, but I'm, slowly like trying to like, pay attention to a tree or pay attention to the wind or the grass or, just bringing my attention to reality, the here and now. So there's little things that you can do to kind of just, and it takes practice, we think the brain is, we hear it's plastic, but it's really a muscle. You have to use it in the same way over and over again. And you can strengthen certain skills, certain pathways. But yeah, that part of your nervous system, and that could be, sitting down when you eat, that stimulates your parasympathetic nervous system. It could be, getting a massage, getting craniosacral therapy, getting acupuncture, doing some breathing, which I'll talk a little bit more about. There are so your diaphragm is probably the cheapest and quickest way to help regulate your autonomic nervous system. And a lot of times I'm taking blood pressure, getting vitals, and I have people just do, simple little breath work while I'm measuring their pulse rate and their oxygen levels, and you can see it all, your pulse go down and your oxygen go up. It's a simple little biofeedback tool.
Yeah.
Um,
Most people that are in a fight or flight state of being, they don't breathe from their belly or their lower diaphragm area below their rib cage. They breathe from right below their collarbone.
yeah,
And those quick, short, kind of panicky breaths with that urgency behind it is just going to trigger more of that fight or flight,
yeah,
more of that anxiety vibration in your body. And when you
yeah.
take the breath down into the belly, this is yogic practices too from my 16 years of teaching. We did a lot of that belly breathing, and it lowers your blood pressure like quickly too. If you have hypertension issues, that belly breathing really takes the pressure down and
Mhm.
calms, it stimulates that parasympathetic quickly.
Yeah.
Hmm.
Yeah. And that's your vagus nerve, which a lot of people know about.
Yeah.
It's not a party like Vegas, but it helps you sleep.
Yeah.
Um, so yeah, the autonomic nervous system is kind of that first, I'm talking about the biological, physiological pieces that are, we want to promote. I do want to talk about kind of the pathological pieces at some point, but right now I'm just
Do
gonna
it. Yeah.
highlight
Whenever you're ready.
the pros, and then we'll talk about the cons, because it's really, most people have anxiety. It's quite confusing. I think people get, obviously you're anxious, so you're anxious about your health. You're anxious. It just everything compiles and it becomes more and more anxiety. And a lot of, well, I'll get into the pathology, but um, so the first one, autonomic nervous system. Second one is neurotransmitters that are going to be, I'm going to talk about them: dopamine, serotonin, melatonin, GABA, BDNF, norepinephrine. So these are all the things that help us feel like we achieved something, like we have a long-term plan, we feel confident, we feel grounded, we feel a general sense of maybe joy. Uh, you're able to go to sleep. GABA is going to be one that I want to really talk about in terms of anxiety, because a lot of the medications, again, benzodiazepines, SSRIs, a lot of the herbs that I recommend are aimed at stimulating GABA. And a lot of the problems, especially with young women in particular, is typically when you get into hormone imbalances and things like that, you have a problem of not enough GABA stimulation. So that could be GABA receptors. There's different types. I actually did a whole program on postpartum anxiety and depression, and one of the main therapies is it uses a metabolite of progesterone called allopregnanolone, and that helps stimulate GABA receptors. So it helps just kind of calm the central nervous system down and helps out with anxiety and depression. Brain-derived neurotropic factor, it's a fun one. That's that's the it's a protein that essentially helps stimulate kind of the neuroplasticity aspect that I mentioned earlier. So recovery from helping develop new neural pathways or helping repair neurons that are damaged, things like that. And then norepinephrine is kind of your central nervous system adrenaline. It's that excitatory, keeps you awake and energized. It's one of the main neurochemicals that is stimulated with the synapses. So what to get from that? Essentially, those are the things that are all supported by different amino acids, regulating hormones. We'll talk about nutrition a little bit because that's going to be such a big piece of addressing anxiety, especially with the younger population, but also with older population because there's impaired digestive aspects that we could talk about. And then, so autonomic nervous system, neurotransmitters. The other one is the gut-brain axis. A lot of people, they commonly people are say like all your serotonin is made in your gut, or 80% or 90% or whatever, which is confusing because serotonin is, but it doesn't actually cross the blood-brain barrier. The serotonin that's made in the gut, but the amount of or lack of inflammation in the gut is crucial for helping lower inflammation in the brain. So a lot of what I do is address digestive disorders because any symptom that's going on in the digestive tract, which I'll talk more about, can raise inflammatory cytokines, which are basically just immune molecules that say you get gassy every time you eat, or say you have a little bit of loose stool here and there. Um, Anything that's irregular, and I'm never going for perfection with anything. Things happen, you eat something, you get loose stool or constipation. But if that's chronic, your inflammation levels are going to be higher. Your brain's not going to function as efficiently. You're going to have those cytokines go to your brain and cause inflammation in the brain. There's even research saying like when you get a brain injury, it actually they see die off of certain populations of bacteria in the colon, which is wild. So there's a huge connection between the gut and the brain.
Interesting. I've heard it called the second brain.
Yeah,
Your stomach,
totally.
your gut, what you put in, what you feed yourself is what you're going to receive, right?
Yeah, yeah. Um, yeah, and if you're ask someone that has a lot of digestive issues if they can think straight. So that's a
Right,
big piece of this.
right.
And then the last piece is what I already said. So it's a two-way street. Your emotions, your stress levels, the way you're thinking, your self-talk, all those things play directly into, your stress hormone production, your adrenaline production, things that, if chronically elevated, cause inflammation. They suppress the immune system. They suppress different sex hormones, growth hormones. All the things you want get suppressed when you're constantly in this fight or flight, and in this, self, frustrated with life. Any of these things where you're either kind of disconnected from your body or just disconnected from your life. Like it's a big stressor on your physiology.
Yeah,
Uh,
that brain fog, yeah,
yeah.
can definitely be correlated to, if you're eating a lot of processed sugar, if you
Yep.
are eating gluten and you're sensitive to it, If you drink too much caffeine, if you're not hydrated well enough, there's so many different components to it. So tell us a little bit more about the main differences in your approach to kind of diagnosing that someone has anxiety and why. I mean, they'll tell you that they have panic and things like that, I'm sure. But to get the actual diagnosis of it compared to like the conventional medical approach to things, which is the SSRI,
Yeah.
right?
So, what the things that I'm looking for when someone comes in with anxiety, I am not di it's typically never just anxiety. There's always some other issue. If it is just anxiety, then that's I don't even know if that exists. Um,
Is it
I've
an
never,
anxiety is a side effect
yes,
of something else,
yeah,
probably nutritionally
yeah.
and
So,
mentally going on together, right?
yeah,
Which is what you just
exactly.
kind of talked about was that gut brain gut connection.
Yeah,
What are you feeding yourself that could be then creating
yeah,
this side effect?
yeah.
What are you
So what
thinking? What's the self-talk too?
exactly? And I get into those things later on, but a lot of times it's just the hard facts around your symptoms. I'm gonna, can I give you a, yeah, let me talk about this real quick. So digestive issues, like I said, I'm looking for any symptoms. It could be loose stool, constipation, gas, bloating, burping, abdominal pain, nausea, acid reflux, anything there. And typically there's a multitude of things in that realm. I would say probably 90% of the people I see have some kind of chronic digestive issue. Typically IBS is so rampant. And that could be caused by a lot of different things. So SIBO is one of the things that I treat the best. I have the best results from. Small intestinal bacterial overgrowth is what that stands for. But it causes a lot of that. It can cause the loose stool, constipation, gas, bloating, everything I've mentioned. Basically, someone will come in and they have all of those, and they haven't had any answers, so they don't really put a lot of weight on it or any hope that that's going to get better. So that's something that I really help out with, and that's typically the underlying issue for a lot of these mood issues. And I'm going to give you a case in a second if we have enough time.
Yeah, definitely. That would be great.
Just a good example of how the digestive tract and other things are playing into anxiety. So the other thing is the menstrual cycle. So any female, premenstrual, perimenopausal, all of it, I'm getting a menstrual cycle history. I'm looking for patterns of prolonged or heavy bleeding, cramping, PMS, any history of ovarian cysts, things like that, endometriosis. Those are things I see quite a bit. So menstrual cycle issues are not dealt with properly, and it's really normalized to have a lot of those symptoms, and they just throw OCPs or contraceptives at it, which is basically hormone replacement therapy. And oftentimes there's estrogen dominance where there's too much estrogen and not enough progesterone. Sometimes even and I'm seeing in younger females they don't have any. They have like menopausal levels of progesterone and estrogen. So a lot of their hormones are just going straight to cortisol, which that's another
That doesn't
fascinating.
sound good at all.
It's a fascinating. I love talking about hormones because it's just, follow the tree. You just get to work your way back up the tree and let's see where things get divided and shunted and herbal medicine and nutrients and diet and lifestyle things are so potent and powerful for menstrual cycle issues and digestive issues.
And do you find out can you do hormone level testing through blood work?
Yeah, so that's conventionally what's done, and that's where
Right.
I branch out is I do more functional hormone panels. So I can typically I look at what's called a Dutch test, which is dried urine. And it looks at all of your progesterone and metabolites, three different estrogen forms, and and what they're broken down into. And that's a really important piece, which I don't need to talk about today, but That's typically what often why I look at that is to see how you're breaking down your estrogens. And then it tells me about DHEA, testosterone, which comes in handy with things like PCOS, being able to see what's going on with the androgens. So fun
That's a whole
terms.
nother podcast, Danny.
Yeah, yeah.
Could do that one on another day.
Yep, yep. So I just want to mention a couple other things. So
Sure.
sleep disturbance is another thing I look into. Stress, coping skills, and tools. I also look into, other sources of environmental infections or toxins. So black mold and mycotoxins are another big issue I see quite a bit. And
How do
then
you detect that in someone's body?
Well, conventionally, it's not well managed or assessed. So typically, I do a urine mycotoxin test, and there's a whole swath of weird symptoms, but panic attacks are is one of the big things that stick out to me, especially based on like location. If you're panic attacks, dizziness, lots of upper respiratory congestion, lots of different joint pains, nighttime urination. Those are kind of some of the big ones. And and then I have a mold questionnaire that I use. And
Is
yeah,
that prevalent here?
yeah, CSU actually has a problem right now. I think there's a lawsuit going on with just a lot of the some of the students are getting really sick. And I've seen maybe
Wow.
three. Yeah, it's not good. It affects every system. It's carcinogenic, it's neurotoxic, it's immunotoxic. It like ochratoxin is one of the main kind of black mold toxins, and that really is harmful for the kidneys. So that's why you get a lot of the urinary symptoms. It can throw off your hormones, it can throw off your sleep, so you get insomnia, but you're still urinating all night. It's a lot of crazy things that
That's
go on.
crazy. Yeah. I would have never assumed that to be a problem in Colorado because it is so dry here.
Yeah, I mean, the way that we build houses is terrible. I mean, you're just, wrapping up pipes inside of walls, and then the building material is exposed to weather while they're building it too. So even in new builds, you can have problems with mold. So, and then, CSU is pretty old, and I don't know what's going on there, but you can visibly see mold in some of the buildings, and I can't remember.
Really?
Yeah. But yeah, throw that on top of, being in college and the situation I already mentioned. So
Right. Yeah, all the things. So you wanted to give an example of a case.
yeah, yeah, yeah,
Let's tell us a story. I love the stories.
yeah. So this was a 21-year-old female, and I just wanted to read off all the symptoms that were reported in the first visit. So I'm just going to go down the line. The main thing that I wanted to before talking about this person has type 1 diabetes, so that means they don't
At
produce insulin.
21. Wow. Yeah.
Yeah, so typically that's diagnosed early because it's autoimmune, and you don't have any more beta cells that are producing insulin. So you're gonna have to be on insulin for the rest of your life. It's terrible. Okay, so symptoms: headache, fatigue, eye pain, dry eyes, sinusitis, so sinus congestion, ear ringing, ear fullness, bleeding gums, cold sores, dizziness, frequent illness, rash, dry skin, hives, abdominal pain, nausea, constipation, diarrhea, gas bloating, blood in the stool, insomnia, hair loss, body increased body odor, heavy menstrual bleeding, menstrual cramping, irregular periods, PMS, vaginal discharge, muscle pain, back pain, migraines, and then anxiety, which is on a GAD-7 questionnaire. It was a 19 out of 21, which is severe anxiety. and also some difficulty concentrating, phobias, irritability. And this person, a lot of people that have anxiety, especially like long when it's been going on for a long time, they often tell me that they're just an anxious person. And I it makes me really sad when I hear that because that's that should not be the case. Yes, there's some genetic factors, of course. Um, but with this person, we did we did quite a bit of testing because there were quite a few different things going on. From those symptoms, I was suspicious of problems with histamine because there's the ear fullness, there's basically a lot of allergy-like symptoms. Ear fullness is a big one I see quite a bit. Dizziness, the sinusitis, um, sore throat, things like that. The hives on the skin as well. It's a clear sign that there are elevated histamine issues. And this is where dietary nuances come in handy because there's a whole list of foods that are high in histamines. And histamines are excitatory. They can cause anxiety as well. And so what's causing elevated histamines? That's really the big question that I always ask is like, why is this happening? Uh, and what we found out from our labs, we ended up doing a SIBO test because she also had a lot of SIBO symptoms and had a history of a positive SIBO test and had been treated before. Um, but apparently it was back. So we did a SIBO test, we did a stool test, we did a hormone panel. What we found, well, the SIBO test came back negative, which was really interesting. And then the stool test came back with elevated Candida albicans levels. So Candida overgrowth in her intestines and um, basically intestinal candidiasis. And what I see a lot in my practice is Candida overgrowth because a lot of people are taking antibiotics for a common cold or you get strep or whatever, you go to the doctor, you get an antibiotic and you don't think about the downstream consequences of that. So over time after you take the antibiotic, you're just eating your normal diet, and which is typically there's some processed foods in there, sugar. And so you end up with overgrowth of certain things because you opened up territory for new growth of things that were already there that didn't get killed by the antibiotic, right?
And doesn't Candida feed off of sugar and it makes you crave it?
Everything does.
Hmm.
Everything. Mold, candida, bacteria, viruses, all of it. Everything loves sugar. You love sugar. It's just uh,
I do love
but
sugar.
but that's like such a big reason why I'm seeing candida issues across the board and histamine issues because going into winter, a lot of the histamine foods are you know, beer, wine, aged fermented foods. So anything that's sauerkraut, kimchi, people think they're eating, gut healthy foods. Those are high in histamines. So if you have an issue with histamines, you're aggravating your histamine levels and ending up with more symptoms. And the reason why is because Candida eats this enzyme that breaks down histamines. It also burns through vitamin B6, which you need for making serotonin and melatonin and dopamine. So you're not getting your neurotransmitters because you're burning through your B6. And then you're ending up with elevated oxalate levels, which is another factor that comes into play with candida overgrowth. And oxalates are basically make up the number one type of kidney stone. So you can end up with more kidney stones. You can end up with joint pains because those oxalates get into the joints. So she had back pain, kind of chronic back pain, 21-year-old, with all these symptoms. So, of course, you're thinking about type 1 diabetes, and that wasn't being regulated properly either because that was blood sugar was getting thrown off while she was sleeping. So she'd get woken up and then cortisol levels are spiked and then blood sugar is high. It's really interesting with type 1 diabetes. This is a pretty complex case, but I thought it was a good example of she had all these things going on and with treatment. So that's what I really wanted to get at was she's reported complete resolution of her sleep issues and her anxiety. And all we did was treat the candida issue and give her some herbs that are effective for anxiety and nutrients, and basic nutrients too. So, a good quality multivitamin goes a long way. Making sure you're getting the B6, the B12, things like that, getting your proper vitamin D levels. Vitamin D is so crucial for, I was going to get to the, kind of first steps when someone's dealing with anxiety. Vitamin D is such an easy, button to press because so many people have vitamin D deficiency, especially with the seasonal affective disorder, or anxiety that stuff comes up in the winter. So hitting vitamin D, and I'm not going to give specific doses just because I don't want to have people do things and it's not appropriate for them specifically. But vitamin D, I expect potentially do like a vitamin A, D, and K together, and then a B complex would be really nice for someone, especially with this issue. And then with this person, I did a formula that had saffron. So saffron has a lot of really good data around kind of acting like an SSRI, like an herbal SSRI. So
Really?
it kind of slows, and herbs are kind of like, herbs are the original pharmacological sources of these different, major drugs that we're using now, right? So they
Straight from the earth
generally,
is always the better way to go.
yeah, and they're not always safe and effective. So that's why it's important to know what you're taking, the dose, the quality, the if it's, you know, not contraindicated with whatever else is going on or whatever else you're taking, and that's where I come in handy. Um, but saffron, and it's a formula of saffron and 5-HTP, which is like a simple precursor to serotonin. Serotonin gets converted to melatonin. So sleep improved, mood improved, infection improved, digestive inflammation improved, bowel movements, all of it, no gas bloating, no constipation, no diarrhea. Best this person has ever felt in years. And it's just like, can you imagine having all of those symptoms and going and having a 6 to 15 minute visit?
Right. Yeah, that just doesn't cut it, you know. Yeah, I'm sure she had to tell you her story and that took some time. That's a long list of things.
Yeah.
Yeah.
Yeah, and that's unfortunately like what I get. Although I'm like my focus is preventative medicine, I end up seeing some pretty like chronically ill patients that are complex and
Right.
can,
Because we're built to, we've been brainwashed to go see your doctor, and do that first and try the prescriptions and then deal with the side effects and then try to wean off of them without going mental.
yeah,
And all that stuff causes damage. In my personal experience, I've been through a lot of what you were describing. I'm not diabetic, but I had a lot of symptoms as far as the anxiety and digestive and reflux and all of that. And I take liquid vitamin. Do you feel like there's better absorption from the research that I've done because I hate swallowing pills?
yeah,
So liquid vitamins are a good go-to for those that just don't like popping vitamins and have a problem with that. I take a multi-liquid of B complex liquid and a D liquid
yeah,
every day. And
yeah,
that's helped with my anxiety so much. And I can tell if I go a day or two without my liquid vitamins,
yeah.
I'm a little more edgy.
Hmm.
It keeps my
Yeah,
baseline at a better place.
yeah, and like to answer your question about liquids and bioavailability, every nutrient is, I think about it like lipophilic or hydrophilic. So all the B vitamins are hydrophilic, all of the vitamin A, D, K, um, E, all of those are fat soluble, lipophilic, meaning they typically do better if they're in like a liposomal solution, which is probably what your multivitamin is in. So yeah, some of those are absorbed a lot better. Like Like even with herbs, like curcumin is typically absorbed better because it's if it's in a liposomal solution. Glutathione is absorbed better if it's in a liposomal solution. There's a lot of different things that are, you know, do are more effectively absorbed in liquid form. But yeah, I could talk for days about every little nutrient and with with herbs, I wanted to touch on that because I feel like a lot of people think they're just herbs, but it's there's so much there's still a lot of need for research around different herbs, and I still run into some situations where a lack of research is really a bummer, specifically around like pregnancy and lactation type of situations, um, and trying to treat some of these things. But there's so much good data around like some of the mental health aspects of herbs. And I wanted to touch on a couple.
Yeah, do you have like your favorite go-tos as far as herbal remedies to help with anxiety and
Yeah,
where people can typically get good quality versions of this?
yeah, yeah. And quality is important. I'll touch on that and after I name some of these. But the main thing that to know about herbs is they're multifaceted. So they all have different properties and thinking about them, I was trained in Western herbal medicine. So there are different ways of using herbs. Like Chinese medicine uses them in a different and slightly different way, and they have a totally different array of herbs that they use and they're in a lot larger doses. And like Ayurvedic medicine uses herbs based on energetics of the herb, which, you could be in school for decades and decades learning on the nuances of how to prescribe herbs based on your patient and the energetics and all of that. But with Western herbal medicine, I'm focusing on the two categories that I'm focusing on are adaptogenic herbs. A lot of people know I've heard that. Adaptogenic just means that it helps kind of modulate cortisol production from the adrenal glands. And your sex and stress hormones all come from your adrenal glands. Epinephrine, so adrenaline comes from the adrenal glands. A lot of important hormones come from the adrenal glands. So helping slow that down, people think like, how do I address stress? Well, this is a good way to help kind of modulate that from that angle. Obviously the other pieces like working on the mental, emotional, but and the nutritional and all the other angles. But adaptogenic herbs that I really like, ashwagandha is one of my favorite. It's one of
The
the one,
liquid version of that, it's so gross, but it
yeah.
does help.
You taking a tincture?
Yeah.
Yeah.
Yeah, I just drop it under my tongue and I feel the difference, but it's not flavorful. It's straight ashwagandha.
It's hard. Yeah. Um, but the liquid, the tinctures, they're extracts, so they're much more potent, which I love, and it's much easier to absorb those compounds
Yeah. I
rather
favor
than
the liquid versions of just about everything
totally.
that way.
Um,
Yeah.
Good. And you can use these things as food too, like their roots. You can make soups and things. I made, when I'm getting sick in the winter, I use some of these roots and mushrooms and things like that to help, boost my immune system and address stress and all that. So ashwagandha, astragalus is another good root.
Write that down, guys. How do you spell that?
Astragalus.
I've never heard of that one. Is that a root too?
It is a root, yep. And
Okay.
it's also quite immune stimulating. So if you have like an autoimmune condition or something like that, you want to be careful with that one, as well as like a reishi. So these are where the nuances are important to know about. 'Cause herbs are not always, appropriate for it. That's why you see someone like me. And then my next favorite one is centella. It's gotu kola is the common name.
Centella. Is that with the C?
Yep.
I'm taking notes here, Danny. Centella. Okay.
And and then and they all have Latin names and common names, so I'll just use the common names if that
Think
might
that
be.
would probably be better. Yeah. Is centella a root also?
Centella is a leaf.
A leaf. Okay.
And I could go into detail about why I like these ones, but the next one is a Luthero, and you don't
Eleuthero. I'm
E
gonna I totally
Eleutherer.
botched that one. Okay. E-L-E-U-E-R.
Oh, and then it's a Eleutherococcus, which is I gave you the Latin name again. I'm sorry. I use them so interchangeably. But that one is really great for helping specifically lower cortisol levels. So I use that one quite a bit. Sometimes people are in a state where they've just been pumping cortisol for so long that
Yes.
they're not making enough anymore. And so lots of difficulty getting out of bed, lots of issues with just circadian rhythm, energy levels throughout the day, things like that. Because cortisol is also excitatory, kind of like histamines. It wakes you up in the morning, right?
Right.
So
The
cortisol,
problem is if it doesn't lower after you're up for a little while,
yeah,
just sticks around and ruins your day.
yeah. So if you're in a state where you have like really low cortisol levels, licorice root is a great option as well.
For low cortisol levels, to elevate your cortisol levels, licorice is good.
Yep. It has a compound in there that actually kind of mimics cortisol, and it looks like cortisol. And
Licorice
it can act
root, are you talking about?
licorice root. Yep.
Huh.
Not the candy, the herb.
Not the chewy stuff.
A lot of
Don't go get candy.
people really are averse to licorice candy, and it's nowhere near. I mean, it's still kind of a weird sweetness, but it's used a lot in herbal formulas just to make it taste up a little bit better. Um,
Stuff,
and
Danny.
then a couple other ones, rhodiola is going to be more of a stimulating one. You want to be careful with that one when you're having a lot of anxiety because it can trigger anxiety with some people. But it's great if you're dealing with a lot of depression, and a lot of just malaise and fatigue. So that's a great one. And then American ginseng is another good one for helping with blood sugar and insulin production. So if you're having a lot of elevated blood sugars, like with this person that's type 1 diabetic, um, and she's not going to produce insulin, but maybe another example would be someone that's just having some insulin resistance or not producing enough insulin for whatever reason. The American ginseng would be good for that.
And isn't ginseng good for like cognitive retention too?
Totally. Asian ginseng is the one that's really energizing. That's the one that in China you're supposed to dose it really infrequently to get the best results. So I wouldn't take that one long term, but it's nice and energizing for sure. Mushrooms. So a lot of people do the mushroom coffee, but there's a company called Real Mushrooms. There's another company so one of my classmates, her name's Anna Sitkoff. She's a mushroom guru. She knows so much about mushrooms. She's an herbalist, like from birth, it seems like. She inspired me a lot in her like connection to herbs and nature, and but she has started her own mushroom company called Lucidum. Um, Lucidum mushrooms. So she's got good quality mushrooms there too. But the first company is called Real Mushrooms, and hers is Lucidum. So quality is really important with mushrooms.
Have you been to Hazeldell by
Hey,
us?
no.
It's on Carpenter Road, right before I-25 heading towards Windsor.
Okay.
Hazeldell mushrooms. You can get fresh trumpet, you can get fresh lion's mane. They grow it right there. You can
Yeah.
get dried.
Yeah.
It's a very cool place. I'd check it out for you for sure if you're into the shrooms.
Nice. Yeah. Yeah,
And
and
they're,
incorporating them like food is probably the best way to reap the best benefits from them.
yeah,
So they're adaptogenic. They're also really, a lot of them like turkey tail is used a lot in cancer therapies. So it's there are different compounds in there that are really effective, anti-cancer, adaptogenic, anti-aging, immune stimulating, things like that. So I love those. And then calming nervines. So I'm gonna shut up here in a minute, and but I just want to give you some important nervines. When people are having issues with sleep, I've found that, and there's a lot of anxiety. I found that valerian root is probably the best option, um, really because it stimulates GABA receptors, and if you're having issues with falling asleep or staying asleep, that's really, really great. And it helps with getting you into deeper sleep as well.
no,
The other one, ashwagandha, I mentioned already, but that's another kind of one of the only kind of sedating, not sedating, but it's more effective for helping with sleep.
okay.
And
Taking it
then
before bed would be helpful for those that struggle with that.
essentially, yeah, with dinner, something like that. And then
Mhm.
passion flower, kava, skullcap, California poppy, lemon balm.
Are these
Uh,
all for sleeping?
Yep. These are all kind of just
Okay.
calming the nervous system down.
Love it. Love
And
it.
then if you're having like blood pressure issues too with this, sometimes people can get like PVCs or different arrhythmias. Motherwort is an herb that I typically use with women for like elevated blood pressure or having any like cardiovascular symptoms.
Mother,
Um, yeah.
my mother has hypertension
Yeah.
and she has these bouts. She went to the ER a week ago for blood pressure 210 over 196 and her legs gave out
Wow.
and she couldn't walk and yeah, it's concerning. But she was fine. She was just making dinner and then boom, like all of a
Mhm.
sudden out of nowhere.
Yeah.
So maybe maybe it's worth coming to see have her come to see you to see if you can help her get that under control.
Yeah. Similar situation with my grandma. It's a lot of uh yeah, there's a lot of confusion around when things are complex like that, and blood pressure is really high. I found that it was actually originating from adrenal hormones. So you can have more kind of rare issues too when you get to that age. Like, you want to keep an eye out for like adrenal tumors and things that can secrete more adrenaline and things like that. But yeah, it's interesting. And then,
So she should probably get her adrenal glands checked, however they do that.
yeah, they don't, that's another thing is testing, like cortisol testing. I would recommend doing like a 24-hour urine test if she's going to do it through our conventional doctor. That's one you can get through insurance. And then, one that I would do would be like a saliva test where you do multiple samples over a day. It's called an adrenal stress profile. But yeah, that just gives me a good idea of like, are you
Interesting.
are
Okay.
you circadian rhythm on point? Um, Yeah, that's an easy one. But if that keeps coming up, that would be a place where I would look, as well as like structural things, like if there's pressure on the neck or because you have baroreceptors in your carotid, sorry, your, oh my God, not your carotid artery. Yeah, your carotid
Yeah,
artery.
your carotid, yeah, that's in your
Yeah.
neck, right where you're pointing. Yes.
Yeah, so typically they do a carotid massage, and that can help lower the blood pressure. So I've done that with my grandma.
She has
Um,
FMD, so
FM.
that's could be contributing to it potentially. So question, if someone, this is really good stuff that you're giving all these examples of things that people could take. At what point would you say you need a prescription?
Yeah. I generally don't when people come to me and they've just been taking random herbs or things like that, it's typically not effective because they're not addressing the underlying issue. So these herbs are great if it's mild, if it just seems like a standalone situation and there's no other issues, but it is always coinciding with something else, and it's really important if you want to be proactive, and not wait to a point where it's really impacting your sleep, and then you end up with just more inflammatory markers down the line, and that leads to more issues, other kinds of swelling, inflammation, hormonal issues, digestive issues, uh, depression. And then typically when people are in those situations, they don't treat their bodies that well. They're not moving as much. They're not eating as well. They're not making as good of choices in terms of like foods and even just getting out of the house is hard sometimes. Getting out of bed, feeling motivated in life. It just can spiral pretty quickly sometimes. So having having someone actually like put the pieces together for you and explain things to you and make it succinct and achievable and not overwhelming you with a bunch of random herbs like we just did in this podcast. um, I think it's I
Hopefully,
think it's
people will re-listen
cool.
and write them all down later.
Yeah, like it's not I'm not saying them to be like, hey, you should take all these things. It's more of a these are the fun tools that you could potentially, have someone really tailor for you, depending on what else is going on.
Yeah. Thank you for saying that specific tailor for you, because you don't want to overdo any of these herbs because they are medicine,
Mhm.
and you could have adverse side effects to these as well.
Yeah. Yeah.
Yeah.
I mean, I've had people take too much licorice one time. They're like, "Oh yeah, I read it was great," and I added it on to what you told me the other things we were taking, and it destroyed all of the hormones and things that we had been working on because it was too much. And licorice can cause high blood pressure. So there are other
No.
issues. So like, I have to like remind people you have access to me. You can message me. You can, if you're reading about something or something's coming up, don't just start taking something else because it might interact with what you're already doing. So that, I mean, that's what I do is help avoid those situations. I have interaction checkers. I put medications and nutrients and herbs in there, check the data. A lot of things are important to double check on. And then, like I said, like if you're buying things on Amazon or going to Walmart or going to grocery store, some are fine, but buying things on Amazon has a big problem with quality and adulteration, and sometimes different companies say they have a certain dose in the bottle, and if it's not quality third party tested, you don't know if you're getting the therapeutic dose you think you're getting, and
Yeah.
maybe it could be adulterated with some kind of heavy metals or something like that. So I'm also typically checking. There's a it's called I think it's called Consumer Labs, but they give me updates all the time on like that's why I mentioned the mushroom company, Real Mushrooms, because they have the highest levels of beta glucans in their mushroom products, and they use only fruiting bodies. A lot of mushroom companies use basically mycelial compounds and mushrooms that are grown on rice medium. So you end up with getting a lot of rice or oat medium in the product instead of the actual medicine.
Yeah. With that, let's chat on one more thing real quick, and then I'll let you go. Regarding mushrooms,
Yeah.
what is your opinion on psilocybin? Just like microdosing,
Yeah, I love it. I think it's the next big. That's why there's so much pushback. It's because
because it's
it's
powerful.
so powerful. There's, data's saying that there's progressive benefits over time, over 6 month period. You have progressive declines in rates of depression anxiety, PTSD episodes, things like that. I think
Yeah.
it's I think there's so much power there, and it's gotten a weird rep, especially like, you watch random shows and people are hallucinating and doing all the crazy things and hurting themselves or hurting others, and that is, I don't know what your experience is with it, but
They're doing too much of it then, right?
yeah, that's
I'll disclose that I microdose.
yeah,
I do for my anxiety.
yeah,
I
and it
take it Monday through Friday and take the weekends off and sometimes Monday through Thursday. But the blend that I take is out of Denver
okay,
and it's three different mushrooms and then lion's mane mixed in.
awesome,
So I just do it one capsule in the morning with my coffee.
yeah,
And it has helped me tremendously. It just like it keeps your baseline at a happier place,
mm-hmm.
because I've struggled with anxiety for a majority of my life, and it's mostly mental.
Yeah, yeah, I think that,
Just a lot of trauma stuff. So, but it has been like a huge, it's subtle, but I've noticed the difference. Like I'm just not as reactionary to
yeah,
things. I'm not as fearful of things. It helps with the networking that we do so much of being an empath and being in a room full of people all talking at the same time
yeah,
is hard for a sensitive soul.
yeah,
And but you got to do it anyway, right? To build business. And the baseline that I'm at is way more helpful to
yeah,
like get through that in just like the day to day. So
totally.
I believe in it fully.
Yeah, and it's fun to think of, like, there's so much power there, but in most things, there's never really, you don't really want a silver bullet either. Like, I hate to say it, but like, you want a lot of improvement, but also like, I want to, like with you, I would be like, well, I want to go back to see what was causing that in the first place too, and see if there's anything underlying there that still needs some help, you know?
I share that on other podcasts,
Yeah,
Danny.
yeah, yeah. But
But
anyway,
it's
I
yeah,
love,
so
I think
it's
there's
it's
so much power
worked.
there.
Yeah.
Yeah,
I think it's
that's
the wave
important.
of the future because a lot of people are so sick of prescriptions and doctors ignoring them and making them feel like a number, and not resolving the root problem.
Hmm.
And I feel like as far as like remedies, these are great remedies, but I also feel like people that have anxiety need to really self-reflect on where they are in their life. There's something deeply rooted in there that's making them very unhappy,
Hmm.
that's creating a fear of the future somehow,
Yeah.
and they need to evaluate what that is,
Hmm.
figure out what they want, that what they really truly want out of
Yeah.
their lives, and then go after it with gusto.
Yeah.
And that will shift the energy too.
Hmm.
And I think that it's important to also, as far as anxiety is, what are those things that you're afraid of and go right after that.
Hmm.
Do
Yeah.
those things that scare the shit out of you. And then
Yeah.
they're not as scary, like public speaking, like networking could be terrifying for some people.
Oh yeah.
That standing in the corner awkwardly while no one's talking to you moments at networking things, it's like no one likes that.
Yeah.
you know, it
Well,
those moments of like, okay, this is really uncomfortable.
yeah,
How can I get comfortable with the uncomfortable?
totally. Yeah, and that's
Right.
what,
And do it anyway. Get comfortable with it and do it anyway and go straight after the things that scare you. So the ones, people, I have anxiety my whole life and I've learned through trial and error.
yeah,
Yes, nutritionally, I went off gluten for 12 years because it made me really sick. And now
yeah,
I can eat it and I'm fine. I have no symptoms
yeah,
because my whole mindset has changed.
yeah,
There was a situation I was in that caused chronic stress and anxiety for me. I'm not in that anymore.
Right.
So checking in with the environment you're in, checking in with the habits you have, the people that you surround yourself with, you know, what can be the triggers that are creating a general anxiety disorder situation or a panic situation? Really get real with yourself. What habits do I need to change? What environment do I need to change? What people do I need to hang out with that are maybe not as toxic to me?
Yeah.
And making some lifestyle changes in that regard. And then
Hmm.
and then going after what is going to serve you better and make you feel better and get out of the self sabotage. So I
Yeah.
think anxiety makes you feel like a victim,
Yeah.
and then you get stuck in that cycle, right? Where you're the victim all the time and life is happening to you instead of for you. And you get into this mindset and this programming creates your personality and all the choices that you make are based around that feeling.
Yeah.
And it
Yeah.
and it it can change the trajectory of your life in a bad way. But you also have choice, right?
Hmm.
On with everything. So,
Yeah.
what are you going to choose to do? Are you going to choose to live in this state of perpetual discomfort and victimization? Or are you going to go after something that's just a little bit scary in a different way
Yeah.
that will empower you later?
Yeah. Yeah, and I mentioned kind of reflecting back on the little steps you take too. Like I think there's like so much pressure that people put on themselves, and myself included. But like really, like how do you just squeeze the juice out of your life, on a daily basis? Like you have to reflect on those challenges that you have, conquered. And like you said, if you the second you keep every time you give up on something or you decide to not to go to that thing because you don't really feel like it or you whatever. I'm not saying you don't, you just have to you also need to listen to yourself. It's a dance. It's a dance of like uh playing with listening to your intuition and listen and also doing things that are uncomfortable because of exposure therapy and getting somewhere in life that you want to is not going to be easy ever. And even
Yeah.
if it was easy, it wouldn't be worth going that direction. And
Right.
you wouldn't be satisfied.
Right.
We are thirsty. We're thirsty for growth. We're thirsty for challenge. And it's everybody's anxiety has a little bit different flavor. So
Mhm.
it's important to make sure that there aren't any of those big underlying, elephants in the room that could be addressed physiologically, like we've been talking about. And seeing if there are more tools that would be appropriate for you. Maybe there's some simple things that you didn't know you were doing with your diet, things like that. Like, yes, your wisdom that you just shared with all your experiences with having gone through crazy relationship things and being more of an introvert and myself included. Like I'm an consider myself a hybrid, but
You got to
it
be as an entrepreneur, don't you?
it takes practice of just
It does.
like it's so cool to see what can come when you put yourself into the world and into a community. And a big difference that I've seen that is challenging is living in a big city versus living in, like, for instance, Fort Collins, which is still relatively big for some people. Um, but that's been a huge thing that I've noticed. The Midwestern culture, and the social connections are generally stronger. It's so hard to feel connected in a place where there's so much transient people moving in and out, and there's so many people. It's overwhelming to the nervous system. It's overwhelming uh, to anyone's social life. And then the culture, like for instance, I was in Seattle forever for 7 years, and you don't walk down the street and look people in the eyes and say hi there. You do that here, And that's what that's what keeps me, connected and feeling like I'm a human and I'm seen, but when you're in a big city, that doesn't happen very often.
You're so right. The energy is heavier,
It's heavier.
and angrier.
It's like wind. It's like the wind. It's cold wind. And I know I'm talking
It's
about Seattle, but
yeah, and it's I can't, I would never be able to live in a big city. I could not
yeah,
thrive there. I need connection. I need to look people in the eyes and say hello to them and smile at them. I enjoy doing that. I enjoy complimenting people and helping shift their energy and make their day better, by saying
talking
something
to
nice to
stranger.
somebody. Right. Say hello to a stranger. We can do that here. It feels completely comfortable.
Yeah,
But you're right. In a city, I would be afraid to look at anybody in the eye. They might shank me. You never know what you're going to get.
yeah,
But I think that everything that you said is really valid in regard to that. In just connecting with, also, I just want to add one more thing and then we can go.
yeah,
Connecting with, I mentioned getting comfortable with the discomfort. But also, it's really important, I think, is to find something that you're really good at, that you really are passionate for, that brings you joy, to and do more of that to elevate your confidence level. I think a lot of anxiety is a lack of confidence in just doing life, being able to function, being able to provide yourself with the necessities of just surviving and what you need to for the basic things,
yeah,
and how am I going to thrive and the indecisiveness of what's to come. And if you can find something that you really love, that you enjoy, that makes you happy, that calms your nervous system, do more of that,
yeah,
and really embrace the confidence and the happiness that you feel around that thing.
yeah,
And maybe that's your go-to long-term plan, maybe that's a career path for you that you might want to follow down that path in some way.
yeah.
Because
I
it
mean,
makes you
I
happy.
I just stumbled into my career and I just followed the most simple interest. It's like, oh, I like going and getting like good, colorful, like good quality food and cooking it and like I feel better. And I like moving my body and my moving my body makes me feel better. And when I eat better and I can move my body better. It's such like going back to basic things and then that led me to like, oh, naturopathic medicine. And then it's like I looked at the website and I'm like, oh, they're actually promoting health. They're actually like talking about nutrition and they're using herbs, they're using pharmacology, they're using physical manipulation like chiropractors, counseling. That's what that's what doctors are supposed to do. Your doctor should be trained in counseling because that's what they're doing. They're counseling. It's just you just have to follow your little interest, exactly like what you're saying.
Do what
Yeah,
brings you joy.
yeah.
Don't swim up current against the current, right?
Yeah, and
Try
it's
your
like
best to not live a life like that.
even if it's expensive like medical school, like your bigger reason why is the backbone of everything.
Yeah.
It's what fuels you forever, and eventually you'll get to a place where you can make money from it. You can help people. You can do, if you want to be an artist, you can get to a place. You just have to keep following your feet and putting yourself out there, and
Yeah.
it's
Don't
it's
give up.
not easy, but it's
Yeah.
super rewarding when you do just keep strengthening your confidence, like you said.
Yeah. Beautiful. Well, thank you, Danny. On that note, I think we're ready to go.
Yeah.
Thank you so much for coming on and sharing all your wisdom and knowledge. It was very much appreciated. I'm so grateful for you. I'm going to add Dr. Danny's show notes down below with all of his website information and anything online that you can engage with him on. You can see patients remotely, correct?
Yep. Yeah, I can do
Okay.
video and phone calls.
Okay.
I typically try to see people in person within the first couple visits. But yeah,
Okay. But they can at least reach out to you for some
Yeah.
for some care
Yeah.
remotely.
So a lot of people are on the fence if they're, unsure if I'm the right fit for them or not. And I typically recommend just schedule a 15-minute visit and I can hash things out. I can explain like where my brain's at and how I might be able to help you. And if I'm not a good fit, then I can point you in the right direction. At least you have a touching point. And I don't hold back in terms of like what I think and what I clinically would be most appropriate for you. And if money is an issue, like sometimes I do payment plans. I've been doing that. So, my focus is getting people feeling better, and that's the primary focus. And if uh, you know, I'm a cash-based practice, so I understand it. Paying insurance and then paying out of pocket is not fun, but when you see benefits and you feel better and you can go work and you can do what you love in life and you can get out of bed, you feel motivated. It's like uh that's healthcare, and that's really like I want to get people to a place where they don't need to see me. That's really my goal. Though I know things come up. So yeah, 15-minute consult would be a great way to just not low investment, 15 minutes, and then we could see what the best choice is for you.
Beautiful. Your heart's in the right place, Danny. We need more of you around. Hopefully, the industry's growing steadily,
Yeah.
and there's going to be more naturopathic and holistic doctors around in the future.
Yeah. I keep having this crazy thought about someday starting one here in the Midwest because they're all on the coast. There's one in Chicago or near Chicago, but yeah, there's some Midwestern culture that I think would be nice to have in a naturopathic medical education. Yep.
Well, best of luck, and I will see you at the next chamber event.
Cool.
Thank you
Thanks for
so
having
much,
me.
Danny, for your time. Again, folks listening, all of his contact information will be down in the show notes, and feel free to reach out. Thank you
Thanks,
so
Bill.
much, Danny. We'll chat with you later. That's a wrap for today, folks. Thanks for spending the time with me. And don't forget to check the notifications below on my social media links, my YouTube channel with self-care and meditations, as well as my omshantihealing.com website where you can get info on spiritual coaching and my online courses. And as always, if you do enjoy my podcast, don't forget to subscribe or sponsor below. We'll talk to you soon. Have a beautiful rest of your week. Bye-bye.